right, in all seriousness, so we're here to talk about the various types of headaches, and God knows there are many, and they range. They range from being just a nuisance that gets in the way to completely debilitating, where people can't go to work or socialize or eat dinner with their kids or play with their family. And so it's a really, really big deal, and we're very sympathetic to it. We don't joke about it. We don't take it lightly. And we don't help every headache possible that a human being can have. And we don't even help every human being who has headaches. But for specific types of headaches and specific types of migraines, they respond beautifully to the work that we do in this office. Which, by the way, most likely your neurologist didn't tell you about, not because he or she is a bad doctor, but it's just outside of their scope of expertise. It's like, you know, I don't look in ears and they don't look at necks. And so we'll kind of go through, what the different types of headaches and the different causes, and in addition to talking about the work that we do in our office, which I think a lot of you are interested in the packet there, we talk about other natural things, because the fact of the matter is, look, nobody wants to take medicine, I get that, nobody signs up for that, but at the same time, nobody wants to suffer either. And everybody is looking to do things as naturally as possible for their bodies. You know, there's definitely been a shift in the last 13 years that I've been practicing, where everybody was running to the pill bottle and everybody's trying to stay away from it. And I get it, there's a time and a place, and for some people it's the only way that they get through their day. But if there's things that we can do that don't put anything into the body or take anything out of the body, most people would say, sign me up. So let's jump right in. So what is a headache? Well, you know, obviously it's not brain pain, you don't feel pain in your brain, but it's really the tissues around your head, whether it be vascular structures, neurological structures, or even muscles, or what we call the fascia. So there's various structures that can get tension or pressure that actually causes sensation of pain. And we break, to keep things really simple tonight, we're breaking this topic of headaches up into two categories, primary and secondary. And so primary headaches are, and there's some overlap, which we'll talk about, are migraines, tension headaches, and cluster headaches. And it does matter to know which type of headache that you have. Now, it doesn't mean we do a different type of adjustment, but we can help predict a person's response to our care based on the type of headache that they have. So migraine headaches, obviously, can be severely debilitating. Lots of times they're one-sided. Most of the people who are nodding their heads right now, you don't even need me to tell you about this stuff. You know about it. You live it. For some people, they get auras for being visual disturbances or visual changes. Sometimes they are just visual. Sometimes the zigzags are the prodromal effect to let you know that a migraine is coming. Lots of times the pressure is relieved by being out of light, because we have photophobia, or sensitivity to light. We have sensitivity to sound. Lots of times the only thing that starts the relief is actually vomiting or throwing up. Sometimes it can last for days, where people are left in a fog for 3 or 4 days. Sometimes they're cyclical, meaning they come with a cycle. Sometimes they're sporadic. Sometimes they come in clusters. When we try to log it and keep a daily log and look for the triggers, and sometimes there's just no rhyme or reason, it just doesn't make sense. Sometimes we blame stress on it, and I get it, like, you know, something stressful is going on in our personal life, and then the migraine hits, and so stress gets blamed. But stress is never the cause. Stress is always, if you already have a weak spot in the system, and we all have one, none of us are perfect, if you already have a little flame burning and then there's some stress, it's sort of the oxygen on the fire, and it's always going to go to the weak spot. For some people, that stressful spot is their sciatic nerve. For some people, it's insomnia. For some people, it's heartburn. And for some people, it's headaches or migraines. And unfortunately, for some people, it's all the above. And so we'll talk a little bit about stress tonight. And then tension headaches tend to be postural. They can come from clenching the teeth, come from eye strain, workstation, accidents, injuries, traumas, changes to the cervical spine. They tend to be a pulling sensation. And the truth is, we have this myofascial envelope through our body. What is that? It's basically like saran wrap that goes through every single muscle of the body, and every single muscle of your body is connected to another muscle through this myofascial envelope. And the myofascial envelope muscles pretty much stop right here at the base of the skull, and then the myofascia goes up and over the head. So if you've ever felt like someone's taking saran wrap and pulling down on your head like this, that's tension in the myofascial envelope. Like, almost like you're in a Spider-Man costume and you're just trying to get out. That's tension headache. So migraines and tension headache responds really beautiful, and we'll talk about how to the work that we do. And then the third is sort of like the elusive one. It's cluster headaches. Cluster headaches tend to, well, we should say this. 26 million Americans suffer from migraine headaches. That's more than epilepsy, diabetes, and asthma combined. That means 1 in 10 people you know have had a migraine headache. That is just beyond me to even think about that. 80% are women. I just tend to see it in young moms. Patients used to ask me, who's your favorite type of patient to take care of? And when you're a young buck, like, I like working with the professional athletes. I like working with young moms now. Because they got the hardest job in the world, and they've got the weight of the world on their shoulders. And for some reason, they tend to be the group of people that get the migraines the most. And I get it. We have little boys who are 11 years old coming with migraines, so it's not all in that group. Now, the cluster headache tends to be men. Tends to be one side behind the eye, and it comes in clusters. It can, people who have cluster headaches can go months or even years without them, and then all of a sudden they go boom, 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 boom. They get hit for several weeks in a row or several months in a row, and they go away for a while. Some of the theory is that it's related to histamine, like almost like an allergic response, or serotonin release, a neurotransmitter, both that are tied back to the nervous system. But they tend to be one-sided and behind the eye. I've had patients tell me it feels like someone's putting a hot poker right in my eye. And it's a serious thing. And the thing about the headache is no one knows how much pain you're in. Unless you have someone who's felt the pain. Sometimes they can see it on your face, like, oh, you're having a headache today, honey. But most of the time you're walking around in pain, just nobody knows it. It's not like you're walking around with a limp, but it feels like you could walk around with a limp. So what are the secondary headaches? So this is a really important conversation because whenever a patient comes into a chiropractic office, especially ours, it's important that they know that if we find that there's an issue that's outside of the scope of chiropractic, that there's something medical underlying, that as a primary care practitioner, we're going to get you to the right person. Now I got to tell you, the things on the list behind me, they don't oftentimes show up in a chiropractic office, and we've done over 120,000 visits. So these are things that I can probably count on one hand that I've seen. But you need to know that. Now and the reason being is most of the time, by the time somebody lands here, they've been everywhere and they've tried everything. They've even gone to the school nurse and the puppy groomer before coming here. Right? So they've tried all the different meds, they've tried all the different specialists, they've been to the headache center down in Jefferson, they've been up to the biggest and best on Park Avenue, the kids have been down to CHOP, and finally they land here. So we know that a lot of these underlying causes of headaches have been ruled out. A lot of people have already had CTs and MRIs and those kind of tests. But there is one kind of secondary headache that falls right into our sweet spot. And that's a headache secondary to a head or a neck trauma that oftentimes, on average, research shows that is 11 years prior to the first symptom. And so most people, the patients and the neurologists, aren't making that connection because it's just not in the line of questioning. It's one of the first things that I ask is, tell me about your history of head or neck trauma. We just heard it the other day, yesterday with a gentleman. Oh, there's been no trauma. And then it comes out that he wrecked his car, but he didn't think of that one. And so lots of times, hey there, come on in. There's a seat right there in front for you. No worries. There's a package for you.
Thank you.
Awesome. So lots of times we just don't make that connection. And previous head or neck trauma can lead to any of the three types of headaches. Migraine headaches, cluster headaches, or tension headaches. Obviously, if there's a blood vessel issue, carotid artery, right, or an aneurysm in the brain, that can cause a headache. And I'm not saying this up to scare you guys. But most people, like I said, your medical doctor has ruled that out. Medications, sometimes the side effect of medications that we take to treat headaches are rebound headaches, or headaches themselves. Lots of times when there's multiple medications in the mix, and the average American over the age of 50, over 50% of Americans over 50 are on 5 drugs or more. It's called polypharmacy. So when you start getting that many interactions, and they're numerous, lots of times it could be secondary to the side effects. Obviously, an infection can cause a headache, but there's going to be other signs. We're going to know that. Changes in the body's environment. Like patients on dialysis, for example, oftentimes can get headaches. Problems with the ear, eyes, nose, throat. TMJ is a big one. You know, if we take care of 100 people in a day, I probably check 15 to 20 jaws in a day. So that's really tied in neurologically to the upper neck and head. Occlusion of the bite. We work with a lot of neuromuscular dentists who are trying to help patients through TMJ work. And a lot of heads are nodding because oftentimes we see a syndrome of symptoms. It's not that the migraine or the headache sufferer just has migraine headaches. They oftentimes have jaw issues, they have dizziness, they have pain along the base of their skull. They may have hearing loss or ringing in the ear. So it's like a syndrome of symptoms that show up in the patients who have upper cervical issues. And then, of course, mental illness can lead to headaches. So those are the secondary headaches and the things that we rule out before we say, you know what, we should really go further and look into whether or not we can help. So what are the causes? So, you know, we do see that there can be a genetic propensity, meaning, you know, my mom had headaches and my grandma had headaches, and but having a kid, there's no gene for disease. God didn't, or nature didn't make disease genes. You can have propensities towards certain conditions, and then there's got to be triggers that turns a gene on or off. That's called epigenetics. And so we never blame genes, but if there's heart disease that runs in a family, there's usually lifestyle factors, stress, diet, exercise, that, you know, and that's why you can have 3 sisters and breast cancer can run in the family and one gets and 2 doesn't, right? So we don't always blame the genes, although they can set you up for that's your weak spot in the system. Chemical, environmental, and emotional sources of stress obviously can be triggers, not necessarily the cause. We have to look at food, we have to look at sensitivities, but again, most of the time when I finally consult with the headache sufferer, they've already tried eliminating gluten and eliminating casein, and they got off the sugar and they got off the caffeine, and they haven't touched alcohol for 6 years. And they've kind of gone through all of that. And yeah, it makes sense. Like if, you know, you drink a glass of wine and you get a migraine the next day, stay away from it. But most of you know it's not as simple as figuring it as that. Jaw clenching is a big one. You know, and that's something, obviously, if you wake up and your teeth are hurting or you're breaking through your dental work, you know, a night guard it can be the saving grace for a lot of headache sufferers. I mean, I've seen patients who have been suffering for years and they get a night guard and it goes away. But there's not one thing for everyone. That's why everybody's case has to be evaluated individually. Hormones play a huge role. It's a shift in the body's neuroendocrine system, and it puts a demand on the body. And there are doctors that can test hormone levels, especially through premenopause, menopause, and perimenopause, where estrogen and progesterone levels may be shifting. And there are some really great doctors in our area that, through saliva testing, if they find that estrogen levels are low or progesterone levels are low, through compounding bioidentical hormone that gets basically rubbed into the high capillary areas of the body, can start balancing out hormone levels. And I've seen that help numerous patients. This is a big one. This is really where we're going to go with upper cervical and what I was kind of alluding to on that short little video that everybody was watching. If there's a mechanical change in the upper neck from prior head or neck injury or trauma, it can interfere with one of 3 things. It can interfere with blood flow to and from the brain. One of the main arteries that shunts blood to and from the brain is the vertebral artery that actually runs through the cervical vertebrae. Cerebral spinal fluid is the fluid that bathes your brain. Your brain doesn't have a all of our brains, doesn't have a lymphatic system, so it has no way of getting waste out of the brain. Every other organ system of the body have lymph. And your lymph is like your sewer system. And so how does the brain eliminate all that metabolic waste? It's the most metabolically active part of our body. It does it through the cerebral spinal fluid. This is clear fluid that bathes your brain, goes all the way down your spinal cord and up to your brain, and it should be constantly flowing. And what we now know is if there's degeneration or arthritis or misalignment or stenosis or disc herniations in the cervical spine, it blocks the flow of this fluid. It backs up into the brain in the ventricles, which are open spaces, and that metabolic waste stays in the brain and can cause plaquing in the brain, can cause pressure on the brain. That was a mechanism that was proposed many years ago, and you'll see a video in a short while of an NFL player who's under this type of care. And Dr. Damadian is the medical doctor who invented the MRI unit. So he is the Thomas Edison of medicine. If you invented the MRI unit, you know something about something. And he invented a new unit called Phonar. It's video MRI. So instead of a snapshot of your spine, it's video live of what the cerebral spinal fluid is doing or not doing. And there's only 2 of these machines in the world right now. That's why none of you can go get the test. One is in New York and one is in Italy. And he's working with 2 upper cervical doctors in New York, and they're putting MS patients, ALS patients, Parkinson's patients, ex-NFL football players in this video machine, and you'll see it in a moment. And they're seeing that the cerebral spinal fluid is backing up into the brain. And right after the alignment is restored to the upper neck, you see the whole shape of the brain change. It's almost like someone flushed the toilet and the water, the cerebral spinal fluid starts flowing. Dr. Damadian came out 3 years ago at a conference in New York, about 250 neurologists, and said the underlying cause of migraines, MS, Parkinson's, ALS, and autism is an uncorrected upper cervical misalignment. That is a bold statement, but one that he feels 100% confident. And he said the reason why it's being missed by the neurologist and the patients, again, is on average 11 to 20 years between the injury and the onset of symptoms. So you may be saying, well, I'm a sufferer, but I didn't have a car accident, or I didn't have a fall, or I didn't fall off a horse. Birth is an injury to the cervical spine for many of us. Most of us don't remember our birth, but most of us have been there or have had children, and it's very traumatic. And oftentimes that's where we can get that first misalignment when the doctor is doing what they're supposed to do and just trying to get baby out. And then, being a father of 2 little ones, the average toddler is falling 30 times a day. When they first start sitting, they fall back on their head 1 million times. Then they start walking and they're falling off the ottoman and the couch. So then there's the playground, then there's sports, and then there's technology, and then there's computers, and then there's stress. And so you can see how you may not have a macro trauma in your life, but we all have micro trauma a little bit over time that could affect our cervical spine. And this is a big one too, but we don't really talk about it a lot. The electrosensitivity. Do you ever feel like when you're just too wired into your technology, your body's like humming or buzzing? I mean, most people wouldn't buy a house underneath those big electrical cables. We don't even have any research to show that it's unhealthy, but we just know that those things are sending stuff into our house. And I hope nobody lives under those things. Okay. But in all seriousness, I mean, our cell phones, our computer screens, all of these things could be putting a stress or strain on our nervous system that could be adding fuel to the fire. So just trying to get your mind thinking, and we can make changes. We can put, look, if you got to go to work and you got to look at an Excel spreadsheet all day, that's what you got to do. But you can create boundaries around your technology when you're not at work. So we want to avoid the common triggers. Obviously, I would never, ever, ever, ever tell people to take medicine or not take medicine. So that's something that you've got to talk about with your medical doctor. Just like it's not appropriate for a medical doctor to give chiropractic advice, it's definitely not appropriate for me to give medical advice. But if you're questioning the interactions of your drugs or the amount of medications that you're on, have a conversation with your doctor. Obviously, food and drink is a big one. These are some of the common culprits. Again, nothing in here is for everybody. This is why you individually have to have a conversation to figure these things out for you. Wheat, dairy, and sugar are big ones. The only way that you would know if they're a trigger is to eliminate it for 2 weeks and then add it back in. If your pattern changes, your pattern changes. Artificial preservatives, chemical additives, cured or processed meats, which they basically link to cancer now, alcohol, aspartame, caffeine, and MSG. MSG, Google all the different names of MSG because it's hidden. It's called other things now too, like hydrolyzed protein, and they can hide it from you. So basically, if there's anything on the label that you don't understand, you probably shouldn't eat that food. Okay, it's probably been doctored and altered by man or woman. Okay, so the artificial sweeteners is a big one. It's a neurotoxin. It literally cannot be processed or broken down by your body, and it gets deposited onto your nervous system. So if you're trying to save 10 calories by not using a sugar packet, it's just not worth it. I wouldn't give it to my worst enemy. It is the most destructive chemical you can eat. Okay? It's absolutely poison. Changes in your sleep cycle. So sleep's a big one with headache sufferers. You probably learned it. You've got to protect your sleep habits. And part of healthy sleep habits isn't just how much sleep did I get tonight. It's really your whole ceremony around sleep. Meaning, what is your hour going into the bed like? Do you have a bubble between your day and your bed? Are you watching like the 11 o'clock news, murder, death, rape at 11, and then going to sleep? And then wondering why you wake up crabby? I mean, really want to create a bubble where, like, just shut the social media off, shut Facebook off, shut the technology off, read, meditate, talk, pray, go to sleep, okay? Set that up, and that will help. Now, sleeping too much is a problem too. Anybody ever realize that? Like, if you get too much sleep, you can wake up with a headache? That's a common culprit too. We talked about hormones. The biggest thing, if someone's fatigued or in pain, I tell them to do is just start drinking water. Now I get it, like I'm not saying water is going to cure your headaches or migraines, but you see, as a wellness doctor, I'm not in the treatment model. So it's not like I give an adjustment for a migraine and I give a different adjustment for sciatica and I give a different adjustment for neck pain. We take care of the entire person. And even if we give the greatest upper cervical care to a migraine patient, and then outside of the office, they're not taking care of their physiology, it's literally like them going home and banging their head against the wall. It doesn't matter what we do. So you have to take care of the entire person. And what happens is, human beings in today's culture, we forget we're animals. And we have to follow the same rules of biology. And what I found is we're chronically dehydrated. So if you're in pain and you're tired, every single process of your body requires water. And if you don't have enough water in your body, it's going to start to pull it from places. So the best thing that you can do is just start to superhydrate. If your dog is sick or your garden is sick or the plant is wilting, the first thing you do is give it life, you give it water. So again, it's simple, it's basic, but most people, if you think about what you drank today, you didn't drink enough. And if you do drink caffeinated beverage, you've got to drink more because it's a diuretic and you're losing water. Your meals are really, really, really important. And I don't believe in 3 square meals a day. That doesn't support human physiology. That comes back from the industrialized era when we used to go to work, clock in, you get a break, you work, you go home, and that's where the 3 meals came from. That's why school's set up that way too. But we really are hunter-gatherers, and our blood sugar levels require that we eat throughout the day. Low glycemic foods, not foods that are going to do this to us. And patients with headaches, when you have that sugar spike and change and that insulin spike and change, are more susceptible. So these are simple things that you can do to help, through lifestyle, prevent. So it's not like, patient comes in with a migraine, and we do see this, but this is not, it's not like to replace an Imitrex. We do an adjustment and you don't need Imitrex today. It's like what we want to do is we want to set up a situation where the train stops coming. Once the train is here, it's here, but we got to get the train to stop coming in the first place. Stress we talked about, physical exertion, so sometimes patients try to do the right thing, they try to exercise, their blood pressure goes up, that physical exertion causes the headache and the migraine. I've seen that many times. External stimuli, so I do believe we're overstimulated, our central nervous systems are just going wah, 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 wah. You really have to protect what's coming in. And that may mean shutting off the television, shutting off the technology, bringing the lights down in your house a bit, and just not living in the dark, but just choosing if there's a lot of noise coming into the central nervous system. And weather's a big thing, you know. Patients don't want to blame it on the weather. Could the weather be doing it? It is a real thing. When that barometric pressure changes, you feel it inside your body. The same way when you're on an airplane and you're landing, and the Dasani water bottle does this, right, upon landing, that's a pressure change. And so when the barometric pressure goes low outside because a storm system is coming in, relatively the pressure inside your body is pushing out. And then when that storm moves through, you go, oh, I feel a little better. And I hear that every single week. And this is why people move to Arizona. They get consistent barometric pressure and they feel great. But we're all living here, so we gotta come up with some other strategies, or move. So never do I want to come across like I'm making medicine out to be bad. The medical profession they're noble professionals that care a lot about their patients and are doing everything that they can within their training and their expertise to help us. There's no one way for everybody, and nothing is right all the time. And what comes, and I'm going to put up a few slides, and it's important to have this conversation, not to make medicine wrong, but to talk about what we may not realize. And so, when we look at some of just the most common pain relievers that human beings take, this came out from an MD, California Center of Headaches. Chronic use of aspirin actually promotes chronic tension headaches. We know that chronic use of NSAIDs, like the Advils and the Excedrins, the naproxens, can cause a rebound headache. And I kind of alluded to lots of times what we're using to help numb the pain today sets us up for a rebound tomorrow. This is absolutely alarming, and this came from the FDA last year. I got this off of Harvard Health Publication, Medical School, blog, July 2015. The FDA strengthened its warning that NSAIDs, again the Advils, increase heart attack and stroke risk. Look at this. Heart attack and stroke risk increase even with short-term use, and the risk may begin within a few weeks of starting the NSAID. So we've been trained to think that those are benign. Like, I've heard patients say, I'm just doing over-the-counter meds. I get nervous, I get scared because I see patients who've been injured by them. I see the patients who have developed ulcers and bleeds because they didn't realize it and they were taking 9 a day. But it doesn't take being on them a long time. They're intended for short-term acute use, not part of a lifestyle. And I had a patient in here tonight, and she's a maintenance patient. I've been taking care of her for years. She comes down from Annandale, and she said the teachers in my school used to come to me because they always knew I had a selection of NSAIDs, Excedrin. I mean, she was like the medicine cabinet. And I'm very happy to say they don't come to me anymore because I just don't have it in my purse. So it becomes like a lifestyle, and we think it's okay and our kids think it's okay because they see that we can buy it over the counter. The risk increases with higher doses and longer period of time. That's common sense. The risk is greatest for people who have already had heart disease, though even people without heart disease may be at risk. So there's 1 million people who are going to have a heart attack this year in our country. And there's a lot of these pills being taken. Vioxx, which is similar to an NSAID, it's called a COX-2 drug, is off the market. And it caused 140,000 heart attacks, according to Lancet, and 60,000 deaths, according to the FDA. If one person died from a chiropractic adjustment, I promise you, it'd be all over the news and the profession would be shut down. The medical doctors aren't bad people. They're not trying to hurt people. But the drugs are dangerous, and we have to look at another way for ourselves and our families, and that's my point. This is alarming. You didn't see this one, I bet. Last year's Washington Post. 48,000 American women have died in the last 11 years from painkillers prescribed by their doctor. Percocets, Vicodins, the opioids. 48,000, that's like Vietnam War numbers. But it's buried. I saw it in the back of the Washington Post. This one study done by the CDC only looked at white women. So that's not even all the statistics. So I do believe we save lives with upper cervical care, Because we don't know how many people, if they were just under care in our office or offices like ours everywhere else in the country, would still be here. These are aunts and moms and grandmoms. Or I think about my patient who's not carrying around the drugs anymore. Every week, my patient's telling us they're getting off of their opioids or gabapentin, Neurontin. It's a game changer. So we don't know what we're preventing. And I think about if these women had been under conservative care, this could have been, this anguish and this heartache could have been prevented. So what are some alternatives before we talk about upper cervical care? So you can do a diet elimination challenge where you start to rotate the different foods. You take a food out for 2 weeks, you add it back in, you see how you do. Don't take 2 foods out, you won't know which one did it, okay? So you start with the common culprits. If you're a big Diet Coke drinker, that's aspartame and caffeine. You're taking 2 things out. Don't drink that stuff, it's not food, okay? Don't even drink soda, drink water, tea, okay? Sugar and dairy and those are wheat or some other ones. Peppermint tea and feverfew, and most of you in this room who are here tonight, you know all this stuff. I mean, you've already looked up, Googled a million times, what else could I possibly do? So I'm not going to spend a lot of time on this. I like, and I've seen this work really well, it's low tech, but it works. If the headache is coming, or if it's here, you put moist heat, it has to be moist heat, it can't be dry electric heat. Moist heat on your upper back, and you put ice on your head, and it dilates the blood vessels here, constricts the blood vessels here, and it shunts the blood out of your head to relieve pressure. So it's low tech, but it can give you some palliative care should you need it. Posture's a big one. It's a big one. You've got to just be aware of it and raise your awareness of your posture. It plays such a role, as you're going to see in a second, in a trigger. Repetitive positions, workstations, you just elevate your awareness of your body and how you're using it on a repetitive basis. Micro breaks are a big one. If you do have a desk job, set the timer on your phone every 30 minutes. If you just get up, change your position, and sit back down, that transfers the load off of one set of tissues, puts it on another, and it's kind of like, we all know there's a point where this pen's going to fatigue, but if I come off of it, I could do that all day long and it'll never break. But what happens is we're jamming away and 3 hours go by and then you got to get up and you're like this, oh, right? So you got to take those micro breaks for literally 5 to 10 seconds. You wake up, you get up, you reverse your posture, you sit back down and you get back to work. Okay, there's great body work that can help. Massage, acupuncture, Reiki, essential oils, homeopathic. These are great things that are outside the box that can be explored. Supplements that have proven to be effective, and again, most of you probably tried this. Magnesium is a muscle relaxer. Don't take too much, you'll have diarrhea. Get the right amount. The B vitamins help alleviate stress. Vitamin D is epidemically low. Have your medical doctor test your D levels. CoQ10 is a big one. Plays a large role in muscle contraction. If anybody's on a statin drug, you have to be on CoQ10 because it depletes the body of CoQ10. The essential oils can help. Lavender, peppermint have been shown to be effective. Omega-3s are really important. If you're not taking an omega-3 supplement, if somebody said to me you can only take one supplement for the rest of your life for you and your family, it would be omega-3, whether it comes in flaxseed or fish oil, a good clean source. The omega-3 fats are the fats that line your nervous system. They line your brain and your nerves. We definitely in the American diet do not get this enough. You have to eat 40 salmon a day to get what you need, okay? So, just eating salmon a couple days a week isn't going to do it. You've got to supplement with omega-3s, especially if you have neurological symptoms. It will help. It will bring down inflammation in the body. As effective as an Advil, it will bring the inflammation levels down. We talked about the foods. This is all in your packet. Avoid exposures to chemicals. So a lot of headaches and migraines are neurological. We live in a chemical world. There's no escaping it. As great as chemistry has made our life, it's come as a double-edged sword because it's causing health issues. So at least in your house, the environment that you can control, get the chemicals out. You can clean your counters with vinegar. You can now, everywhere, whether it be Whole Foods or even Target, we use a lot of the 7th generation products. You've seen it. They have it in all the food stores now. Spend a couple extra bucks. Look, you're either going to pay the grocer or you're going to pay the doctor. Pay the grocer, okay? Spend a couple extra bucks. Get the chemicals out of your house. You're eating off a counter that you put Fantastic on? That doesn't make sense. So again, I don't know if it's going to, fix your headaches, but certainly going to take a load or a stress. And if we take a little bit of load off your nervous system here, and a little bit here, and a little bit here, and a little bit here, all of a sudden we're holistically creating a better environment for our central nervous system. So it's not just about, what can I do to get rid of this headache? What can I do to get healthier so my headaches don't arrive? Keep a diary. And most of you have probably already done this. Oh, this is a big one too. Also what you're putting on your body, right? Get some good quality products, natural products. They're all over the place now. Don't put chemicals on your body because it goes in your body. Keep a diary. If you haven't done so, you can learn a lot from it. Most headache and migraine sufferers I consult with have already done the journaling thing. They're like, I'm done with it. Okay, so a lot of you have, obviously are here to learn a little bit more about what we do. And through the years, and the reason I'm really passionate about this is I've seen a lot of headache and migraine sufferers do amazing through upper cervical care. And it's amazing to me that we've been here as long as we have, and there are those of you who are in the community that didn't even know this was available to you. This is not traditional chiropractic care. A lot of the patients we consult with have already been to the chiropractor. Not making them bad or wrong, this is just a different ball game. Let's get into it. So one of the goals of upper cervical care is to correct the mechanics of the upper neck, to relieve pressure on the brain stem, the nerves that go up into the head, restore blood flow and cerebral spinal fluid flow to the upper neck. Now, when headaches can, it's basic neurology. I've through the years have taken care of a lot of professional college and high school athletes who are dealing with post-concussion. Post-concussion headaches or symptoms. And it's so common now, right, with football players, and girls soccer is another big one. And lots of times, by the times I've consulted with these young athletes, they've already been to a number of doctors for over a year. A lot of them can't read because it triggers a concussion. They certainly don't socialize. They don't go out because they don't know if they're going to get hit with the headache while they're out with their friends, so they avoid out of fear, right? Does it sound familiar to some people? And with all the specialists that they've been to, none of them show up here with a neck MRI or a neck X-ray, as if the head and the neck aren't connected. It doesn't make any sense. But traditionally, specialists specialize in their body part. So if you go to a neurologist, or even the concussion center in Summit, or the experts down at Thomas Jefferson, they look at the brain. They're trying to rule out all those secondary causes of headaches. The bleeds, the tumors, the infections. I always say to the patients, thank God. They're upset that the medical doctor couldn't find anything. I said, thank God they didn't find anything. Do you have any idea what they were looking for? You wouldn't even be here if they found what they were looking for. But after that, it becomes symptom management. It's not treating the cause. And so they never look to the cervical spine. And how could you bash your head playing football? I did it. I played for Manalapan in high school. Or how could you hit a soccer ball and have a concussion, or be in a car accident, have a whiplash, and have headaches, and not look at the person's neck as a potential cause? It doesn't make any sense. And so it's pure logic, but it's being missed. So we talked about chiropractic not being an aspirin. It's meant to bolster your body's innate intelligence. Your body's meant to be well. You're not defective because you get headaches. We're not made imperfect, but lots of times we need a little push in the right direction. So when Ken, who, I remember Ken, he used to walk around with his Imitrex prescription for a year. He didn't believe that he wouldn't have to fill. He'd get like 9 a month or something like that. And all of a sudden it was lasting him, and it was lasting him. And after a year, I finally said to Ken, I think you can throw the script away. And we had a good laugh about it, and we still see Ken. And, but it's not a cure for the headache. What we do is we take the pressure off the central nervous system so the body can function the way it's intended to. Headaches are not a shortage of Topamax. So it's a different paradigm. So this is what happens with the upper cervical spine. If you're looking straight through your head, so this is the base, this is your skull. If you're looking straight through, your dad was right. You have a hole in your head. Okay? That was the joke part. You're supposed to laugh. I always say nothing will ever hurt in my office except my jokes, okay? Okay. So underneath the skull is this really unique bone. It's this one here. It's called the atlas, or C1. It's named after the Greek god that held up the world, that holds up your world, your brain, your skull. And the atlas is really unique because it doesn't have these interlocking funny joints like the rest of the spine has, like chairs stacked up. And it's the only level of the spine that doesn't have a disc above or below. It's freely floating. Now, it's not really floating. It's held in place by soft tissue, muscles, tendons, and ligaments. And it allows our head to turn each way, about 180 degrees. And it turns on the axis. But it comes as a double-edged sword. Because it only weighs 12 to 14 ounces, and because it's not locked in, you think when you're doing some traumas over the course of your life that little vertebrae can slip? Absolutely. And unless it's really severe like Christopher Reeve's, most of us don't even know it happened. But then what happens is it interferes with the neurology of the body. And all of a sudden you look back and you go, oh, what happened? I'm just not healing the way that I used to heal. And lots of times it's not like someone shut the switch off on your nervous system. It's like a dimmer switch where year after year after year you look back and you go, I'm just not healing the way that I used to heal. And so that subluxation, the worst one is the misalignment, the worst one is the one that doesn't have a symptom because we don't know to do anything about it. And so what happens when that vertebrae misaligns or slides out of position, it causes the skull to tilt. You don't walk around like this, so your body starts to change its position to keep your eyes level with the horizon. And so individual bones don't misalign, spines misalign. What bone's out of place right now on me? They all are. And so what happens is, from various traumas in our life, and this all relates to the headaches and the migraines, I promise you, you get hit here, you get hit here, you get hit here, the body goes off center. It leads to abnormal movement patterns. Gravity continues to work on the body. The body can't go into the ground under the force of gravity, so what it does is it spins. It spins and it buckles. So if you picture a Pepsi can and you press down on a Pepsi can, it won't collapse. It's strong. The second you twist the Pepsi can just a little bit at the top and the bottom, what happens to the structural integrity of the Pepsi can? So by the time the joint that you get the x-ray, the MRI, and there's arthritis, or there's a spur, or there's a disc herniation, that means the body has been squashed and compressed for years. It takes 20 years for arthritis to show up on an x-ray. It didn't just happen. So a lot of these processes, by the time you start to experience headaches and migraines, it was a process that was building for years. The man who dies on the tennis court didn't get heart disease that day. He didn't know that day when he put his tennis shoes on that he had a problem going on in his arteries. And so most people don't know they have this misalignment until there's a symptom, and that's changing because we're educating patients to let's get your families checked before, let's get your kids checked, their teeth checked before they need a root canal. Let's get spines checked before we need to make a neurologist appointment, okay? And so that's the process. And what makes upper cervical difference is we unwind the entire compression through the upper neck. We don't push here, here, and here. That's old chiropractic. That's like using a rotary phone to call California. It'll still get you there. It's not as good as the iPhone. And so there's about 2,000 upper cervical doctors in the world that specifically, gently measure and adjust the spine through the upper neck. And the only reason why you haven't heard of it, because there's only about 5 of us in New Jersey. When I got out of school, there was nobody in Monmouth, Ocean, or Middlesex County doing this work. And it helped me so much, having been a football player, that I decided to bring it back home. And so, right before the Super Bowl, I'm thumbing through the channels, and this is on ESPN. They're doing a documentary on the 1985 Bears. Remember the Bears, right? So they won the Super Bowl. Their quarterback was Jim McMahon. And a lot of these football players, as you all know, are dealing with the effects of CTE, migraines, headaches, concussions. And they featured upper cervical. Jim McMahon is part of that study that I was telling you about with Dr. Damadian. And so it's a 3-minute clip for you to see the change in the brain structure following the upper cervical adjustment.
One day, maybe 3 months before he got himself. To me, it was the same old day, but he was a little more quiet than he usually is. He talked to me about it. He said, Matt, it was frustrating to get in my car pick up my kids and I can't figure out where their school is, or I can't figure out how to get home. But I would have never in a million years thought he could do that to himself. And then I started having the same problems. Bad headaches, pressure on my skull. I couldn't see very well, I couldn't talk very well. All I wanted to do was lay down, because my head was just constantly pounding. The pain had gotten so bad where if I had had it again, I wouldn't have been here. And these two doctors from New York called me and said, hey, we think we can help you. We think we know what's going on. I said, let's do it.
Jim was diagnosed with early onset dementia. He had been complaining about a brain fog, as he described it, as well as he described it, a headache where he felt like ice picking on both sides of his brain.
While most concussion studies are focused on the brain, McMahon's team traces the effects of CTE directly to the upper spine, having found that neck misalignment can block the flow of spinal fluid and pool toxic proteins directly onto the brain.
Spinal fluid is white. That's the spinal cord. This is the spinal column. What you're seeing is a narrowing of the opening where the spinal fluid is supposed to come through.
Most of the time when you're having head problems, that's all they look at is the head. These guys were smart enough to at least look below the head, at the neck, and see if there was a problem somewhere, and they found my problem. They're not going to be able to reverse the damage. Like I said, that stuff was sitting in there for 20 years. So how much it ate away at my brain, I don't know.
Using detailed images captured by the MRI scans, McMahon regularly receives targeted adjustments, clearing the blockage and restoring the flow of spinal fluid.
This instrument is going to generate a gentle mechanical tapping that is just lightly going to put those bones right back in normal condition. Okay. Going to sit back up.
First time they did this procedure, within 2 minutes, it was like the toilet flush. I could feel the stuff actually leaving my brain. My eyes cleared up, my speech cleared up.
The left is before, the right is after. So you see how much there is there? See how there's less than here?
So the white is fluid on the left, the right is after the adjustment.
So it's already starting to break. Over the next several days, I'm going to do for it.
What damage is done is done. I can't reverse that. But what these guys do for me, they keep me from having these bad pains, having these suicidal thoughts, having me function fairly normally while I can.
I think lives are at stake with this information, and when there are football players and people committing suicide over this type of thing, and they need to know that this is available, and I think it's amazing that this was on last month. Yeah.
Is this the same type of thing that you do?
Yeah, absolutely. So you saw the instrument being
Yeah.
used. And so basically within upper cervical care, there's about 6 different upper cervical methods. We're all sisters and cousins of each other, you know, for layman's purposes. For 4 years I had that instrument. I've always been a hand adjuster. We do hand adjusting, it's all very gentle, and you're going to see a picture of it in a second. For 4 years, I brought in 3 of those instruments, and we were one of the few clinics in the country that were running both techniques at the same time. And there have been breakthroughs in upper cervical care over the last 2 or 3 years, and we cannot get the correction with the instrument that we can get with our hands now based on this new information that we know. And so ethically, I sold off the instruments. They went off to a chiropractic school, and we are solely manual adjusting. But Dr. Rosa takes care of my patient. He's up in Monticello, so if I have patients that go up to Monticello in the summer, he goes and he takes care of them. And so we can still speak the same language, we use the same x-rays. It's just the method, the tool. His is an instrument, mine is hand. That's all. Same procedure. Yep. So, God, I mean, there's nothing more powerful than that video, but there's evidence that exists that indicate disorders within the cervical spine can cause headaches. We see this throughout the research and the literature. This is another big one too. In the Journal of Human Hypertension, which is the world's leading blood pressure journal, the world's leading blood pressure researcher, Dr. Bacchus, at the University of Chicago School of Medicine, teamed up with an upper cervical doctor, and they studied upper cervical effects on blood pressure. And what they found is, on average, it was a 14-point drop in systolic and 8-point drop in diastolic. And so it was more effective than the control group. And that's because autonomic control of blood pressure is regulated in the brainstem of the upper cervical spine. And we know that headaches and migraines can be tied into high blood pressure issues. And again, we never take patients off their blood pressure medication, and there's lots of causes of blood pressure. But if it's related to the upper cervical dysfunction, we've seen many patients through the years reduce or get off their blood pressure medication. Their doctors do it, of course. So we rely on three-dimensional X-ray series. These are different X-rays than traditional medical cervical X-rays.